If you work in an office or have been around schools or any public setting, you know that flu season has begun. Very important to know some tips of flu prevention and what you can do during this time of year. Joining us today is Dr. Blessey from Spring Hill Primary Care. How you doing?
Doing fine.
All right, we're here to talk about influenza. First of all, what is influenza?
Influenza is a virus that attacks the respiratory tract, specifically the nose, throat, and lungs. And it can be a relatively mild illness to a more severe illness that requires hospitalization. Usually the death rate from the flu can range up to 25,000 deaths per year from the influenza. In addition, there's about 100,000 hospitalizations for the flu each year.
Wow. So what are some of the symptoms of the flu?
Generally fever, chills, cough, sore throat, fatigue, headache, and sometimes on occasion nausea and vomiting, especially in children.
So if you're experiencing some of these symptoms, what's the next step?
Try to isolate yourself from others, and you could certainly call your physician up and seek guidance. We certainly don't recommend that everyone come see their doctor if they have mild illness. Definitely we recommend individuals come see their doctors. One
of the things you said was isolate yourself. Flu spreads rather quickly, doesn't it?
Yes, it does. The most common mechanism of spread is through respiratory droplets. If someone coughs or sneezes, that is the main way the flu is spread, through these respiratory droplets. Usually if someone sneezes or coughs, you have about a 6-foot range that these droplets can spread. So in a closed environment, it can move and transmit very rapidly. So isolation, in a sense, or at least staying away from people who have the flu, washing your hands frequently around other family members and co-workers who have the flu is very important for reducing the spread of influenza.
Your nurse Lori is here today, and I'm actually going to get a flu shot right now. Tell me a little bit about the flu shot. You can come on in.
Well, the flu shot this year, actually you're going to get a 2-for-1 special.
Okay.
The flu shot this year covers for 3 different viruses, including the H1N1 virus that was made popular last year, and that's also included with this immunization. So that's a real bonus. Remember last year the H1N1 caused a great scare in our society, but luckily it turned out to be a mild illness. The problem with the H1N1 last year was that the mortality was much higher in younger people as opposed to the elderly. So fortunately, you're a young man, and you're going to be vaccinated against the H1N1 also.
All right. You can get started here. Talk us through what she's doing in this process.
Well, usually we inject into an area that's not located toward any vasculature in the lower deltoid or tricep area. The influenza vaccine is not to be given in children less than 6 months of age, and also in people who have an egg allergy. The shot itself is pretty painless. And it can cause some local reactions, some pain and redness around the site for 1 to 2 days, and it's relatively innocuous. The big misconception I have in treating or immunizing people against the flu is the fact they feel as though they may get the flu from the flu shot. That's incorrect. It is a dead virus that we use. The problem this time of year is that there's a lot of other viruses that can certainly mimic the flu, and oftentimes people catch those other viruses after they get the influenza vaccination. So there's a misconception in the lay public about that.
That was quick, easy, and it wasn't that painful at all. So we appreciate all your tips today. Get the flu shot if you haven't. It is the flu season. Dr. Blessey, thank you so much.
Thank you.
Appreciate it.
All right.